Okay, I'm Alan Fleckner. I'm a real physician. I'm retired military of 37 years, and I have private practice as an emergency physician for 27 of my 47 years. I was asked here today to portray a Civil War surgeon, no one in particular, just to give everybody a demonstration of what actually went on in a Civil War field hospital. The Coon Barn at that stage of 1863 was used as a Confederate field hospital, so they had real casualties here. And some of the armamentarium that I have is down here. This is the surgical side of it, the knives that were used to start an amputation, a bone rongeur. When you get down and cut the bone, you can chip off the end of it so that it's smooth. The saw that cuts through the bone, there are various different types. I have depicted pictures. That you can see, you had broadswords, hacksaws, you had circular wounds. Over here, you cut circularly around down to the bone. Then you had flap incisions over here, and an oblique incision over here. You just use these big knives to cut down, cut off, and form a flap. We move down here. This is what caused all the damage. These are replicas of bullets. This is a smooth bore musket ball. It caused very little bone damage, but a lot of tissue damage. This is a mini ball. This is a, I don't know if you can see it, this is a mini ball off the battlefield. This came out of a rifled Enfield. The range on the musket ball was maybe 100 yards. This could go out from anywhere to 400 to 900 yards. It spun, so it was fairly accurate. The tactics that they used in those days was to line up a column of troops in line and march to each other and fire. With a mini ball, it was very dangerous. It was more accurate, took you out at a longer range. The tactics of Napoleon did not fit the weaponry of the Civil War, and it took a while for them to learn that, to use entrenchments to protect themselves. That didn't happen until later on in the war, by 64, 65. Down here are some of the instruments that you would use for minor injuries. This is a bullet forceps. You go down, grasp the bullet, and take it out. This is a probe. You go into the wound site, touch whatever's at the end. There's a little, not wax, it's a little porcelain thing at the end of it. You touch the bullet, you can scrape it off, and you can see it's metal, not bone that you've hit. But the best thing that we had to use to probe a wound was my finger. Unclean, dirty, into the wound to see what was down there. This is a unique instrument. It's called a trephine. It's used to cut into the skull. You push the little point out, pull it back, and slowly turn, and it'll cut a piece of bone out of the skull, so you can put an elevator in and lift it up and take it out, and this relieves pressure that's on there. Or if you have a fracture that's a depressed fracture that does not want to come out easily, and you can't get the spatula underneath it, this will make a hole for you to get close to it. This is an arterial hook, or as we call it, a tenaculum. You grab the end of the vessel, pull it out, and you can tie your ligature around it and cut off any bleeding that would occur. This is usually after a amputation. Seems my little weight and balance doesn't want to work. In case I had to dispense medication, I could use the weights in here and measure out my morphine or opium and give it to somebody. This was also used to put in wounds. It's an astringent. It will constrict blood vessels and stop small bleeding. But the unfortunate thing is you're putting opium into a place that can be absorbed, so you don't know how much the patient got. Back this way is my anesthesia. There will be one surgeon doing the surgery and another surgeon giving the anesthesia. This is an ether cone. It went over the mouth and you poured ether onto it. Of course, I'd be lying flat till the patient was anesthetized enough to do the surgery. This is a chloroform. Same thing, you used chloroform to do it. Most of the anesthetic was chloroform rather than ether. Ether was flammable, but chloroform caused more nausea. You put Vaseline around the mouth here so you didn't burn them, put this over it, pour it into that, and the patient would be anesthetized. If I had to use the last resort, good old Kentucky bourbon. You can give this to a patient as a sort of a pre-anesthetic like they did a lot, or you can use it alone if you didn't have anesthesia. Now, most people have a myth that's saying we didn't use enough anesthesia, and it's not true. We took people down to an excitement phase. They would move around, they would cry out, but they did not remember anything and could not feel anything. We did not take them down to a deep anesthetic phase as they do today. We didn't have the implements to measure and monitor. If they took them too deep, they would die. These instruments are used. The bone goes through here, it wraps around. When you're cutting, it pulls up the soft tissue so you can get a deeper cut at the bone. You should cut the bone about an inch deeper into the tissue so that you can make a flap over it and make a better cut. This is used if you have two bones. This goes between the bone and the other goes around the outside. This is a tourniquet. You use that while you're stopping, before you start your anesthesia, before you start cutting. This controls bleeding. When you finish amputating through the bone, you will use the tenaculum that I showed you, grab out the blood vessel, tie it off. The veins were left to constrict by themselves. It was just minor bleeding. You went to control that. If there were any nerves alongside the blood vessel, you separated the nerves so you did not get any pain afterwards from a neuroma or a neuropathy of the bone. Each surgeon or doctor was given a chest. I am Confederate and I happen to capture this from the Union. It shows a lot of liniments, most of which were of no value to cure anything. So we close the lid on this and don't use it. This is a list of what was in the average doctor's traveling kit. This is a pocket surgical kit. You put your instruments in there and carry it around with you. To tie off wounds, we use silk. This is real surgical silk, or cotton linen to tie off the wounds. Now, the trick that they used in those days was to thread the needle. As any woman who sews can tell you, when you can't get the thread into the hole of a needle, what do? You put it in your mouth and you put it in the needle. Well, they did that the same way and then put that into you to tie you off your ligatures. The environment that we worked in was entirely unsterile. Yet, after 30,000 amputations in the Union Army, because the Confederate statistics were burned in Richmond during the war, we have no statistics on Confederate surgery that's reliable, at least that I've found. Other people may disagree with that. But the mortality rate was only 25%, which was very good for the time period. Remembering that the germ theory was not invented or found by Pasteur till 1870 or so. So they worked in the dark. They didn't know that there were little killers out there that would take you out. For everyone that was wounded, there were 2 died of disease. There were 624,000 deaths. If you have any reliable statistics, they vary on what book you read. 2 to 1 with disease. There were 2 disease deaths for every 1 battle death. The camps were dirty. The young soldiers coming in did not have real physicals. They were off the farms. They got measles. They died of measles. You put a lot of people into a closed area. The sanitary facilities were not good. They didn't learn that till about 2 years into the war. Then they started to clean things up. But again, they were working with what they knew. They didn't know about bugs. They didn't know about mosquitoes causing malaria or yellow fever. So that we did the best we could with what we could. You've got to remember we did very well. And as one of our esteemed physicians in his last speech in 1911 said, if you go to any small town, you will find many monuments on the Civil War, on the veteran, but you will not find one monument to a Civil War physician, except at Mass General Hospital. That's it.